Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about Friebergs Infraction, and I'm going to do that through answering the four questions. Number one, what is Friebergs Infraction? Basically, that is a injury to bone that causes poor circulation to the bone and cartilage, the tip of a metatarsal, typically the second metatarsal. And so what happens is you start to have the bone, due to poor circulation, poor flow, start to degenerate, start to die, similar to what you will see when you get another condition that happens right to the bone right underneath the cartilage called an osteochondral defect, where the connection between the bone and the cartilage starts to die and you get a flattening of the cartilage or even a divot in the cartilage. So Friebergs Infraction is a similar problem to the second metatarsal, causes significant pain to that joint area, can cause pain with range of motion, can create a significant problem. Number two, why does it happen? The biggest reason is injury. You're injuring that bone in that area, and because of that, you interfere in circulation in such a way that the bone starts to die. That being said, this doesn't happen to every individual that injures that area. It happens in just a small group of individuals, and can be pretty problematic, and sometimes they don't even know exactly when they injured it. They just know that they're having significant pain in that area. Third, what can you do for this at home? The biggest thing is you can decrease pressure to the area. So the problem with continued pressure is you're continuing to put motion and pressure on that bone. You will get a death of a higher amount of the bone and a bigger long-term problem. Number four, that being said, I do recommend that if you suspect this being your problem, that you should be seen by a doctor as soon as possible, because immobilizing and doing certain things can allow it to recover. There are also newer treatments that allow it to be treated and get you back to normal without significant cartilage damage, without having to do anything to the joint itself. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 197, Friebergs Infraction. And although this is not a common problem, it can